Hello, Coachella Valley, and welcome to this episode of Live with Your Chamber. I'm your host, Katie Stice, President and CEO at the amazing Rancho Mirage Chamber of Commerce. And we brought you this video series really just to share local stories about amazing businesses, what they're doing here in the community, nonprofit organizations, just incredible people that are making our Coachella Valley a better place to live, visit, play, all the things. So today we want to introduce you to GenesisCare. Have you heard about it? If you have, just leave a little comment below, maybe where you're watching from, say hello. If you have questions, you can add them as well. But at this time, let's bring out our guests today. Please welcome Dr. Carolyn Barnes and Dr. Ted Ling to the show of GenesisCare. Welcome, you two.
Hi,
Thank you,
Katie.
Katie. Hi.
Thanks for having us.
Thank
Oh
you.
my gosh, we're thrilled that we have you on. You know, we were joking a little bit earlier before we went live. This is kind of the logo color of GenesisCare. So I feel like I'm getting an A+ today. But so for those out there that are watching today that maybe have heard your name but aren't sure who you are, what you do, can you tell us a little bit about GenesisCare?
Sure. We are part of a cancer care team that includes a surgeon, a medical oncologist, and then us, the radiation oncologist. So we're sometimes used to kill a cancer that cannot be removed with surgery. And we can help save you from losing a limb in the case of an extremity sarcoma. Sometimes the tumors are involved on the face, and surgery can cause a disfigurement or an unsightly scar. Radiation therapy can help. For instance, anal cancers use radiation therapy, so patients don't need a colostomy bag permanently. So we can actually save that area and you can have a normal life. And also radiation is used just to clean a post-operative bed. So, some individual cells that might still be there are killed so it doesn't come back. So we're part of the large cancer care team that is really designed to help cure the cancer and maintain your quality of life.
Incredible. And I think it's incredible that this is here in our valley. It's really, really special. It's very specialized. So we're thrilled that you're here helping people to get well and lead the life that they want to live. It's really meaningful. Can you tell us a little bit more about what you do as radiation oncologists?
Sure. I'll address that. I'd say radiation therapy plays a role in probably the vast majority of cancers, at least probably 3/4 of all cancers out there. It's usually part of the cancer treatment program for each patient. So every diagnosis is very unique and every treatment program is tailored specific to that patient, to that diagnosis. So as Dr. Barnes mentioned, radiation might be the sole treatment modality for that patient, or it might be part of an extensive program, including both surgery and chemotherapy or even immunotherapy. Radiation therapy is given sometimes at the same time or in sequence with those other treatments, depending entirely on that patient's unique diagnosis. So as a radiation oncologist, when we see the patient, we collaborate very closely with all of our colleagues, with our other physicians on the patient's cancer care team, so that we are on the same page as them, so that when we deliver radiation therapy, it's kind of tailored specifically to what that patient needs.
Fantastic. And can you tell us a little bit about your philosophy when it comes to treating patient needs?
Yeah, so we are very patient-centric, and we spend at least an hour with our patients the first time we meet them. We see what their treatment goals are and what their lifestyle is and what their just their value system is, so we can get the best care for them and walk them through the whole process, because it's a very scary process
Very.
being diagnosed with cancer. And so it's just good to make sure they know as much as they can so they can make the right decisions, and just knowing that we're there for them during the whole step.
And can we really start to dive into the technology that you have? I think is the one of the most special things, in addition to that care and philosophy you have with taking care of those patients. But the technology is something. When I took a tour there, I had just never seen or heard anything like it. Can you share a little bit about what that is like?
Sure. Yeah. So nowadays, radiation therapy is very targeted. It's come a long way in the past few decades. The new machine that we have here in our Rancho Mirage office is called the TrueBeam. It's kind of a jack of all trades radiation therapy machine in the sense that we can treat pretty much any site in the body with any technique that we need to. And most importantly, we have millimeter accuracy pretty much with this machine. So when we designate a tumor to be treated, whether it's in the lung, the brain, in the pancreas, we're able to basically image the patient out and map them out in 3 dimensions, so that when we do deliver the treatment each day, we know that we're hitting it, and we know that we are avoiding pretty much all the normal tissue around what we're trying to treat.
It is incredible to see. I mean, again, when we had our ribbon cutting there and I took that tour and saw the equipment and really started to learn more about targeting that cancer so that it's not harming other organs or other parts of the body, my mind was just blown because it just seems like people have the best chance of healing and again really living the life that they want to live. Is this equipment, I mean, is it rare? Is it new? Is it located in other areas of the country? Because again, it was the first time I had even seen or heard about it here.
So yeah, to answer, I guess, all your questions, it's new. I don't know if I'd call it rare in the sense that every radiation oncology facility in the country will need some sort of machine to treat with, but I think it is unique here in the Coachella Valley in Rancho Mirage that we do have a brand new machine. It's probably the newest machine in quite a radius in this area, and it does offer pretty much all the updated modalities and techniques that we need. So in that sense, it is new. It is very new and cutting edge, but I think it provides what everyone in the Coachella Valley needs as far as cancer care for radiation therapy.
Yeah, and it's exciting because it helps us do our job better.
Yeah.
We can do it more safely, so we know we're actually hitting the target that we want, to be treated, and there's less collateral damage around it. So it helps us do our job in a much better and safe way.
Well, it's incredible. It's incredible to see. It's incredible to see you both and the amount of care and love and time and attention and expertise you put into it all is it feels great to know you're here in the valley helping people. And for everyone who's out there watching, I have on the ticker just some information about the website and the phone number if you're looking to learn more or get a hold of GenesisCare and find out a little bit more about what they have to offer. But speaking of that, can you talk a little bit about any other special services that you have to treat and care for patients?
Yeah, so we try to get patients in as quickly as possible. Being diagnosed is very scary. We don't like to leave our patients hanging and wondering. So we have a policy where we will get patients in to see one of us physicians within 2 business days, as soon as you make an appointment. So we really get you in as fast as possible, so you can get your answers and you can get your treatment started as quickly as possible.
Appreciate that. And can you tell us where you're located, both in Palm Desert and in Rancho Mirage?
Yeah, so the Palm Desert office is a little bit north of the 10 freeway on Washington Street. It's kind of across the street from the Sun City
Okay.
living place. And then the other location is near, the river and also Eisenhower Medical Center.
Perfect. And just one last, maybe kind of more personal question for both of you is why do you do what you do?
So I love being with patients during this stage of their life. I like teaching them about it. I like trying to calm them down. And of course, I like to follow up with them after their cancer is treated. I want to see how they're doing, how they're living. I want to know about your vacations, and I just love to see you getting back to your normal life after your treatments are done.
Yeah,
Oh,
it's
Dr.
a
Ling?
meaningful battle for sure. And it's something that often, goes on, even before and after, we see them. W-
Hmm.
We're only a part of their entire journey, but I think because our philosophy is believing in treating the entire patient, we make
Yeah.
sure that we address really all their needs. I mean, yes, we provided radiation therapy, but a lot of times the treatment itself is only half the battle. There's recovery, there is, rehabilitation, there's a lot of supportive services that the patients need. So in addition to Dr. Barnes mentioning that we get patients in very quickly, we also set them up with all the supportive care services they need, whether it's physical therapy, speech therapy,
Wow.
down the road. So the survivorship is also a big part of what we do. So I think, yeah, we do the treatment, of course, but long term, as Dr. Barnes mentioned, we do like to follow them, see how they do, and see how we can assist in their recovery, back to normal.
Yeah, and this is just a job that I just love. It gets me out of bed in the morning. I've had, a lot of members in my family have had cancer themselves, and so
Hmm.
it's just very personal to me, and it's just, I just love doing this, and I hate cancer. I want to kill it, so
Yeah. Yeah.
that that's why I do it. So
Yeah. Well, and it shows. I mean, your hearts show when, when I've met you and taken a tour and really saw the facility and the equipment, technology, and where things are now, I could just tell how excited everyone was about this work and helping save lives. It's remarkable. So, on behalf of the chamber and all the families, that are out there, we just want to say a big thank you. Thanks for choosing to be in the Coachella Valley, both in Palm Desert and Rancho Mirage, doing this work. It's phenomenal. And again, for everyone who's out there watching, please don't hesitate to reach out to GenesisCare to talk a little bit about cancer treatment plans and options. And these are some great doctors and resources right at our fingertips. So thank you too for joining us today on the show and sharing a little bit more about GenesisCare. We really appreciate what you do.
thank you very much.
Thanks.
You got it. We'll
Mhm.
see you soon, guys. And thanks so much for joining us today on Live with Your Chamber. We live in such a special valley with amazing amenities, amazing experts, and these are just a couple of them. I left the information right up on the screen if you'd like to learn more. And if there's a way that the Chamber of Commerce can help connect you with great resources or great experts in the valley, we're happy to do so. That's what your Chamber of Commerce is here for. So please keep us posted. And thanks for always tuning in as well. We really appreciate all of the community support. One of the best things about being a part of the Chamber is members shop, dine, play, use other members, and a lot of the community comes to the chamber for great resources like GenesisCare, who is on our show today. So we look forward to seeing you all soon. Take care of yourselves and each other.